Oh, very good question. I forgot to mention that. Yes. So, you know how would you apply any cream to a day one baby, a newborn baby? A baby is just born. How are you going to apply a cream? You're going to apply it like this and gently move it. Okay, gently move it. So it could be a moisturizer. It could be anything, because the skin in elderly, as we grow older, the skin is going to thin down, so you can't be really doing anything you want. You can bruise your skin. So and if it is a damaged skin, like it's a dehydrated skin, or you're for acne, I've seen people doing it like this, you know, and going repeatedly. Each time you go over an area of the skin, you're actually potentiating the effect of the cream twice. So you're going to be prone to more problems. So you have to apply it just once, move it in one direction, and that's it. Max 2. But do not keep rotating it like that, and do not use pressure. Okay, more pressure or a longer rubbing is not going to ensure better results. It may damage you more. Basically, same. Face wash is a layman's word. Cleanser is something what doctors would like to use, and it's also, you know, some products have the word cleanser written on it, some have face wash written on it. And the cleanser can be used on the whole body. A face wash, people are very hesitant. Oh, it is only for the face, it's not for the body. So it's like that.
Thank you.
I was thinking that it is because when we put some makeup to remove it, we use cleanser. Is it not that?
Yes, yes. So we use the word cleanser for that, and these cleansers are used for that also, but they are not ideal makeup removers. So makeup removers are, you know, the ones that are actually available. With micellar water is one of the best and safest to remove makeup. Yeah.
Okay. Thank you.
Yes. So dark circles under the eyes have, of course, multiple reasons. There is a lack of blood circulation happening around the eyes. It could be epidermal pigmentation, actually caused by, caused by friction. So many people have this dry eyes, and we keep rubbing our eyes, and the skin below is dry. And the more you rub, the darker your skin can get. So that is one thing. People who use eye drops also can have a certain reaction of irritation and keep rubbing that. So that could be the second reason. The most important reason is lack of sleep. So even if you have 8 hours of sleep and you're not having a good quality sleep, you're going to have a lack of stagnation of the blood flow around the eyes. And that is going to create, a lot of deoxygenated blood being collected there, and the color looking darker for you. So that's how it is. So it can be dark as dark as raccoon eyes also.
So what is the remedy?
Question about this about the face wash.
Can I ask a little bit more on that?
Yeah, sure.
So doctor, I have seen her. That's my friend whom we are talking about. For last 30 years, I've seen the dark circles. You know, so she has gone to dermatologist and things like that, but it's not reduced. So you're saying basically the reason can be just not good quality sleep?
Yes. People are not working on that, and they want external methods to heal. Honestly, creams will not help much if you're not treating the problem. If the cause is not being dealt with, we are just doing a little time pass here, you know, applying something or the other to keep the skin looking good. So your texture may look good with the creams that you apply, but the color will not get better if you're not really getting a good quality sleep.
Okay.
Have you seen how your skin looks so beautiful when you have a deep sleep of 8 hours? You wake up in the morning and you love your skin when you're watching it in the mirror, you know. Your skin is so relaxed and clear and soft. It feels magical at that time because you've rested so beautifully. And trust, if she's sleeping a lot, if she's also using creams and she's got a good quality sleep, then I'll definitely want to investigate her iron levels, thyroid levels, and B12 levels. I'm absolutely against scrubbing, because scrubbing is for people who have very normal to oily skins, and in the summers, so these are all, you have to have these conditions before, that your skin is healthy and you're working out and you're sweating and you have oily skin, then you may want to scrub your body or a face once a month. The more you scrub, the oilier your skin can get, the more acne you can get. This is for the oily skin people. For the dry skin people, if you scrub your skin, you're getting in for an inflammatory process on the skin, and you can get an inflammation, a redness, and a damage to the skin. So I'm not a big fan of scrubbing, but if you have normal skin, then you may do it definitely, a gentle, mild, say like granulated rice at home, powdered rice at home is a good enough scrub. You have a walnut scrub in India by a company called Himalaya. That is also very gentle, but do not keep rubbing. The more you rub a scrub on the face, you are actually creating micro trauma on the skin. It may be workable and doable for a oily skin, scarred skin, acne post scars ke liye. That may help in regenerating also, but not for a normal skin and a dry skin person. Yes, absolutely. So for when the days when you feel like in winter, especially if you feel your skin is feeling very tight and uncomfortable in spite of using a moisturizer at night, you may use a mild moisturizer in the morning first and top it up with a sunscreen, or mix the two and apply it. Not a problem.
No. Since you said moisturizing as well as sunscreen are both important in the market, there are brands which have a combination of sunscreen with a moisturizer.
Yeah, definitely can use that.
We can use those, right?
Yes. In India, you have something called Episoft AC. You have Rivella. These are ones that are moisturizer with sunscreen. So if you have other brands that are
Clinic.
Yes, that's also very nice.
That's nice. So we can use it, no?
Yes, absolutely. Yes.
Thanks.
Okay. So the face wash, like I said, you pick up something like Cetaphil Gentle Cleanser. And in India, you have a lot of varieties. You have Moist, you have Nevsoft, you have Episoft. So these are the gentle cleansers that do not dry up your skin, and they are pH balanced. And in case your skin feels dry in winters, then there are moisturizers, which are not having chemicals which are comedogenic, which are harsh, or which are pro-inflammatory. You have the ones that are anti-inflammatory, soothing ones. So there are a lot of moisturizers in the market that are suited for sensitive skin. They're made only for sensitive skins. And similarly, a sunscreen, I would recommend only an aloe vera cream for you then, because chemicals, even I'm not a big fan of in sensitive skins. Yeah, aloe vera is the best deal over here. And since you're not treating anything on your skin, that would be. And in case your skin is scared of using a product, you can just go once in a way and get a good peel done, a chemical peel, so that your skin gets rejuvenated, refreshed. A newer skin comes up, and you're looking good to go as again. But that is only if you feel the need, like there's a function in the family, you could invest in that. Otherwise, just a regime with even retinol will not do a damage to your skin. Give it a try. If there is anything that you're worried about, call me, meet me up. There'll be no problems. Don't fear using a product. So these are called Acrocodons in our language. We love to use big words, but they simply mean skin tags. So where would they come up? When a skin rubs against another skin fold, that's when those areas you're prone to getting those skin tags. And in the menopause time, like I said, the collagen, the underlying, steel structure of our skin gives way. And because it gives way, the skin starts folding over each other. And we get folds of skin. So in our neck or our armpits or the abdominal area, where skin turns into, falls over another layer. So when the skin is rubbing against each other, or a chain is rubbing against your skin on your neck, or the armpit is brushing against, your skin on the side of your breast, at that time, the skin is so prone to friction that it gives out these growths, skin tags, and they happen commonly seen in families. So if your mom or your nanny or your grandparents are prone to it, it runs in that you've tried a horse tail fiber and things like that to get rid of it. A little very toxic ways to remove that. It is not easy to remove it at home, because it's like you have to pull that out. So the only way to remove it is using a small chemical that we use called trichloroacetic acid, or we use a cautery or a laser to knock those off. So I would recommend that if you use a retinol cream, on the areas that you're prone to, you won't develop them because the skin is regenerating all the time. That you've tried any night creams, that anti-aging creams that are popularly there in the market, if anybody wants to use, never ever use it in the morning. They're all meant for the nighttime only. If you use it in the daytime, you're going to get a lot of sun damage because it's actually peeling your skin and tightening it and creating a newer skin. So if you wear those products in the morning and go out, you're going to be in trouble. Okay? So see that all the anti-aging creams are used at night, morning only vitamin C and sunscreen. Have already, you've got a good healthy skin. I'm not going to tell you that yes, you need a facial, but if you are not into any skincare program, you're taking a lot of stress, the usual humdrum of life has got to you, and the skin is looking dull, I think a facial is a very good thing once a month.
Okay.
Yes.
All right. Thank you so much.
Because it gives you a massage to your skin, and blood circulation gets improved.